Now, a special presentation from 12 News.
Say his name. George Floyd. Say his name. George Floyd.
The killing of an unarmed black man by a Minnesota police officer sparked global outrage, leading to protests in the U.S., cities worldwide, and even here in Providence.
George Floyd's death reignited a movement. Now, 2 years later, we're examining changes that have been put into place to try to bring about social and economic inclusion and learning what work still needs to be done. Welcome to Diverse Discussions.
Good evening. I'm Chelsea Jones.
And I'm Shannon Heggie. Thank you for joining us for this special presentation, Diverse Discussions.
Over the next half hour, we'll examine where we stand and what progress has been made in our community in the 2 years since the tragic death of George Floyd.
And joining us for this conversation is our group of panelists. We have Greg Almeida from the Providence Foundation and Jim Vincent, president of the NAACP Providence.
We're also joined by Lisa Ranglin of the Rhode Island Black Business Association and Angela Uncoma with the Rhode Island Foundation. Thanks for joining us tonight, everybody. And in the past 2 years, what specifically have we seen change when it comes to social inclusion and justice? We'll give this one to Greg.
So, I think that the answer to that question is that the results have been mixed. I think for sure there's absolutely a heightened awareness and specific actions have been taken. I mean, if you look at some of the things that the esteemed panelists that represent RIBA, Rhode Island Black Business Association, the NAACP, and the Rhode Island Foundation that have done, there's clearly movement. But one of the things that's happened is that COVID has actually exposed another fissure, I think on a deeper level. And one of the things that we now know is that there's real disparities in our healthcare and our financial systems. And so I think that a lot of the answer to that question is really dependent on where you sit on the socioeconomic ladder. If you're a professional, if you're part of what I like to call sort of the cognitive elite, you're probably doing okay. But if you're frontline, hourly, probably not so much.
Yeah, Greg, we've certainly seen that disparity throughout the pandemic. You know, the death of George Floyd gained the attention of a whole new generation of white Americans who joined the protests and made the voice against injustice and racism louder. But it's important to note that for mainstream America, there are still some people who don't get it, who don't understand the key issues behind the movement. What do you see as the disconnect there? Let's start with Lisa on this one.
Yeah, so that's a great question, right? When we think about looking back and looking where we've been, I think too often people are afraid to come to the reality. Like, again, we have a serious issue in America as it relates to race. And I think there's still a lot of people that are in denial, right? And they're not willing to really come to the realization that, yes, we have a problem. And I think that's some of what we're seeing. If you're unable to really agree on there is a significant issue, 400 plus years, Black people have been left behind, right? So until we are at that place where folks are really ready to step up and acknowledge what has happened to Black people, keep in mind we didn't ask to be here, we were brought here, right? 400 plus year, and still we're fighting for equity and inclusion. So I think, what I would challenge people to do, and white people in particular, think about, start feeling, it's okay to feel, uncomfy, right? When we're talking about race relation issues. It's okay to feel uncomfy when we're talking about disparities, right? But I think what we can do, all of us collectively, white, brown, Black, or whomever, we can start thinking about how do we call ourselves out first, but really talking to our neighbors, talking to our children, and making sure that we understand that we do have a disparity within communities of color. The Black community, we have been left behind for a very long time. Absolutely, people have been talking about commitment to equity, racial justice. And we've seen lots of people out there, companies have put out letters of support specifically for Black people. But some of them are looking at it more from a compliance perspective, right? And we got to move away from that, and we got to go with intentional work. And I'm sure Angie can speak to a lot of the work that we're seeing here at RIBA, but also at the foundation, specifically around closing some of the disparity gaps.
And Lisa, that's a good point that you made. So piggybacking off of that, this group can respond to this. We've made significant progress since the civil rights movement, right? But how far do we still have to go? So Jim, I want to ask you about this one.
Well, actually, it's a mixed bag. I mean, sure, we've made some progress, especially when you look at the civil rights movement in the 60s with the 64 Civil Rights Act, the 65 Voting Rights Act, and the 68 Fair Housing Act. However, you still have black unemployment that's double white unemployment. You still have disparities in education, health, housing, every single sector that you can imagine. There are still disparities 50 years after the civil rights movement was supposedly, solving most of these things. And what I've seen is that, you have, since George Floyd, you have a lot of white people that have called, let's say, the NAACP, wanting to help, wanting to be intentional, wanting to be anti-racist. However, there's been a backlash, especially in the period of the Trump presidency, where people feel that they're at a Waterloo. Certain white folks feel that they're losing their country to the other. And the other is always people of color, and we've always been the other from the beginning of our time here. So, you have some gains. I mean, we've had President Barack Obama, we've had Oprah, we have LeBron James. But for the majority of black people, progress, for some in terms of professionals and in other areas, you see that. But for the masses, there's an argument that can be made that there's been little change for the masses over the last 50 years, and even over the last 2 years. Well-intentioned programs, there's a lot of money around, so things are getting better. They're not getting worse. But racism, I mean, there was something that just happened recently on the east side with neo-Nazis here in Providence, if you can imagine that. So, it's a mixed bag. You have some things that are great or good, but you have other things that are really problematic and suggest that we're in for a bumpy road over the next few years.
Jim, thank you. Our viewers over the past few years have probably heard the terms racial equity and equality used a lot. Many say understanding the difference between the two is key to dismantling systemic racism in America. Angela, can you explain the difference for those who don't know and how important understanding that difference is?
And so oftentimes, I think it's an important distinction to make. Oftentimes we use those terms interchangeably, equity and equality. And equity means everyone gets the same. Regardless of what you need, you get the same. And so if I were to use an example here, is as if every one of us on this panel here were to get a shoe, we would get all the size 10, right? Everyone would get a size 10, regardless of the size you wear. Equality takes into consideration what you need and what is good, what is needed for you. And so equality really takes into consideration what the person and individual needs to make sure. And so while I may wear a size 10, I may be flat-footed, so I might need an insert. And while I may wear heels, my heels may be a little bit different than Lisa's because she wears 3-inch heels and I may wear, 2-inch heels. And, Jim's shoes may be different than mine because he may wear flats or, something with a more rubber sole. And that's really the essence of equity, is really taking into consideration the needs of each individual and making sure you're meeting them where they're at. And I think oftentimes when we think about equality and equity, utilizing an example such as shoes, it'd be ridiculous to think that everybody would wear the shoe size, right? And I think when you think about equality, it's like everyone getting the same. It just isn't feasible to ensure that we have equity because not all of us are beginning in the same place or at the same starting point.
It's a great way of explaining it. Thank you, Angela. And our coverage continues in just a few minutes. We're going to take a look at the issue of economic inclusion and what's being done to address inequalities in home ownership and the workforce. Please stay with us.
Welcome back to Diverse Discussions, a special 12 News presentation.
2 years after the death of George Floyd, we're talking with local community members about racial equality and what has and hasn't changed.
And another big topic, economic inequality and ways to address it. A 2019 EEO report shows the median income gap between black and white people in Rhode Island. And as you can see, for men, the median salary is just over $61,000 for white men. For black men, it's over $57,000.
White women are taking home around $56,000 compared to $50,000 for black women. And when you see these numbers, what is your first reaction? Lisa, let's hear your reaction.
saddened by it because the fact that Black women we're only making 64 cents on the dollar comparing to a dollar that that white man makes. But a lot of it is driven by occupational segregation. So when you think about, and then the lack of sort of mobility for people of color as it relates to moving up either the corporate ladder or advancement. And some of that is based on the occupation that they go into. It's not like we don't want to be compensated fairly and equally, or we don't have the appropriate skill set or qualification. We're shut out in most cases. So I'm absolutely not surprised by this. A lot of it is driven from biases, right? They are assuming, white people in most cases are assuming that Black folks are not educated, we're not smart enough, and we can't get to these really high-paying jobs. And the job that they're sort of allocating for us is really that low-end paying jobs, right? So again, there are studies out there that talks about in a 40-year career, right, for a woman like myself, over my 40-year career, I'm probably losing $1 million, right? Because I've been underpaid all of my my career journey, right? So I think one of the things that Rhode Island has done very recently is to pass the the pay equity bill. I know that is not going into effect until January 1, 2023. But the great news is, hopefully, we will get to a place where the next generation will have better outlook than I did when I started my career many years back. But again, the chunk of it is around segregation as it relates to employment, and then the lack of access to good paying jobs.
And Greg, can you speak to the state of workforce diversity here in Rhode Island? How do we retain workers, attract more diverse employees? Can you speak to that?
Yeah, so the attraction and retention piece is an interesting one, because I'm a believer that in terms of attraction, you start where your feet are. And so one of the questions that I have is, what are Rhode Island employers' commitment level to bringing in diverse talent across the organization, as Lisa said? I think that in terms of representation at the entry level, mid-level, lower level, there's pretty good representation, but as you start to go up the ladder and you start to look at some of these organizations, it is actually abysmal, the lack of diversity that we see running some of these organizations. So the state of workforce diversity, again, for me, it's mixed. And my answer always is, with these types of questions, it depends on where you sit. The original intent of diversity, equity, and inclusion, or diversity and inclusion specifically, was really about lifting people up from entry-level jobs, training them, promoting them, et cetera. I don't see that we do that very well. I think that what a lot of companies do very well is count heads and say 30% of our workforce is this or 20% of our workforce is that, but I'm not seeing a whole lot of development going on. So there's a tremendous room for improvement in that area from where I sit.
Greg, thank you. I want to move to talking about healthcare. And Jim, I know you touched on this at the beginning, talking about disparities in healthcare, especially that COVID pointed out about how much higher risk Black Americans were for COVID-19. And a report from the Office of Minority Health shows African Americans are generally at a higher risk for heart disease, stroke, cancer, asthma, flu, and diabetes. That's just to name a few. In your opinion, Angela, what factors here in the U.S. may contribute to all of that?
You know, I think one of the things that we don't talk about, how race and racism takes a toll on its body. There's a researcher named Dr. David Williams, and he talks a lot. There's extensive research, not research solely by him, but research by others in our country. It really looks at how racism impacts all of us. You know, we talk about, actually just read a headline today about how childhood birth outcomes are at an alarming rate recently. Black women have had 2 to 3 times as higher rate of childbirth outcomes. And when all things are equal, including education, unfortunately, Black women still have a high rate of high infant mortality as a result of the one thing that it does point to is systemic racism, you know, regardless of education. And traditionally, in other indicated areas, when you have a higher education, some of those disparities disappear. But unfortunately, for that particular indicator among Black women, it still persists. And when you look at recent immigrant women who are of the African diaspora, the research also says that they have better birth outcomes than women who have been in this country for longer periods of time, who have had to sustain long periods of perceived racism. And so the data is clear that racism impacts our health outcomes, whether it be heart disease. We saw this illuminate and highlight itself again during COVID. You didn't have to tell me during COVID who were the communities who were going to be disproportionately impacted by this, unfortunate global pandemic. And once again, you saw historically marginalized communities, particularly the Black and Latino community, again, disproportionately impacted. And so I think we have to ask ourselves, what are we going to do so that when the next crisis erupts, that the same communities that have been disproportionately impacted economically, educationally, health aren't the same communities that are still suffering at disproportionate amounts. And really looking at what we need to do moving forward with some of the resources that we have so that we begin to see different patterns, because right now, systemically, it's not changing.
Angela, thank you for your insight on that. Jim, this question is for you. Affordable housing is a huge issue nationwide, and recently Governor Dan McKee announced $12 million in state recovery funds that will be used to support the creation of affordable housing here in Rhode Island. Now, this money is coming from the federal fiscal recovery funds, and in your opinion, will this make a difference?
Any kind of money spent on affordable housing will make a difference, but however, we're in a crisis when it comes to affordable housing, so we need a lot of money, multiple millions. I think the Rhode Island Foundation even said that half of the state's stimulus money probably should be spent on housing, and I agree with that, because we've been in a very unaffordable environment for years here in Rhode Island. Rhode Island has been a place where access to housing has been a problem for over 20 years, if not 30 years. We have probably the lowest Black homeownership rate in the country. So when you have those realities, you're going to need a lot of money, and a lot of education, and a lot of connecting of the dots to make a difference in terms of homeownership, in terms of people renting, and in terms of tackling the homelessness problem. We are in a very, very bad situation here in Rhode Island, and investing millions of dollars, $12 million, certainly will help. But we are in a lot deeper crisis than I think people may realize. It's going to take a lot of money to get us to where we need to be. People are going to be feeling more pain here in Rhode Island than they are in the vast majority of states in this country.
Jim, thank you for your perspective. And coming up, we're going to take a look at the work that's been done over the past 2 years to help bring about lasting change. Stay with us.
Welcome back to Diverse Discussions. In the immediate wake of George Floyd's death, many people began asking themselves, what can I do when it comes to their own racial identity? And Angela, I know I spoke to you specifically about that 2 years ago, and you were talking about how important it was, especially for white people, to say, what have I been doing? Do I need to look at the way I treat others? Do you think that that is happening more now?
I think that, it continues to happen. I think there are some people who not only have asked, what can I do, but how can I help and how can I stand on the lines with some of my brothers and sisters who have a different complexion than me. And that's been really reassuring to know that some people stand in line with us. I also think that there are others who moved further. There are others who have fatigue, who're tired of talking about it. They've made their statements. They sympathize with us in 2020 and 2021, and they've moved on, right? This is something that's existed for years, and they've thrown their hands up, but there's nothing they can do. And then I think there's another group of the population that really has gone in the opposite direction, right? It's become really polarized where, this topic is really sensitive, where, they don't want to talk about it. And in fact, it has become a taboo topic. And I think that is probably the part that's most hurtful, is that there's some who don't even see this, and some who continue to, polarize this topic and make it politicized as well, too.
Why we have to keep talking about it. We thank all of our panelists for joining us today.
Say his name. George Floyd. Say his name. George Floyd. Say his name. George Floyd. if we be the change, fight for this change, and we're going to get the change.
You know, the younger generation is so many of us in the population is so great that we need their voices.
You can find complete coverage of this topic in all of our Black History Month topics right now on our website, WPRI.com. Have a good night.